each other until...
Mama Romang, are you live on the air all the way from Ghetto?
Thank you.
Mama Romang ke a go dumedisa mo tsatsing la gompieno re mo Health Unpacked mo lenaneo le leng gore mo go lone re le ka go bua jalo le batswana ko lapeng le baretsi mo seromong se se tona sa Duma FM kana rona ha re bua ga re bue le batswana hela re bua gape le batswana le baretsi le gore ba ko mahatseng a sele ba le gone mo dumafm.co.bd mo DSTV mo channel 919 mme bile gape re simolola ko Rustenburg go go tsana Plum Tree tatsele tsa Zimbabwe kana ke ra terrestrial jaanong ba re ditse mo tsatsing la gompieno re bua ka kganyelo re ke kganya botlhokwa thata mma go ngwaneng ka go kopa gore take us through the process of HIV testing and what it means to be newly diagnosed with HIV.
All right, thank you once again. Let me start by saying an HIV test is a process which is used to determine whether one is infected or not with the human immunodeficiency virus. Which is a virus that weakens the immune system. This can only be done by someone who has been trained. The test is done by collecting whole blood through fingerprints. Before we do the testing, we do pre-counseling, which entails explaining to the client the risk reduction ways, like the use of condom, number of sexual partners, and also the services that we offer is Tebelopele. This is done as a way to calm the client as they're waiting for their results. As Tebelopele, we use the vagina testing algorithm, which comprises of 2 key test kits, which are determined and unigold. We start off by using determined test kit. If the result comes out non-reactive, that is showing one line on the control line, it means the client is HIV negative or there's no HIV. Then if the result comes out reactive, that is showing 2 lines, both on the control and the patient line, it means the client is HIV positive. We then perform another test to verify the result by using the unigold test kit. If the result comes reactive, it means that the client is HIV positive. The client then undergoes a verification test, which is done by a different tester, where the client is tested using the parallel method. Parallel method, I mean using determined and unigold at the same time. Then the result is that still positive. The client is linked to care and treatment. But in a nutshell, we say a client is newly diagnosed after that process. Also, in test 2, which is unigold, if the result can be non-reactive. In such cases, we perform another test using both test 1 and 2 at the same time. Then if the results are still discordant, we report the client's HIV status as being indeterminate. Then the client will be requested to come for retest after 14 days. Then post-counseling is done regardless of the results of the preventative measures.
Right. So if this is my HIV status. How can I cope with a new HIV diagnosis? Okay.
First, you have to ask yourself what it means to be HIV positive.
Right.
What do you know about this when not being HIV positive? Just try to get more information. And also understand that being HIV positive is no longer a death sentence and it is a manageable health condition. If you need counseling for acceptance,
right,
just get counseling. Be in close contact with your healthcare provider. Then stop being ashamed. Do things that bring pleasure to you so that you give your life meaning. For example, you can just go out with your friends, because those are just ways of trying to cope. Also, learn to ignore or not go with whatever you pick from the hearsay. For example, like the HIV needs or new HIV development that has not been proven. This one goes hand in hand. They are being informed or being knowledgeable.
Right. So how can I deal with HIV stigma and discrimination? Kera haretla go nna ha tsere lebella kganyone ya gore jaanong ha ke ra batho ke bara ke barulong kana ke ntse jang bone be ba etsa ka mokgontsing jang ke ira jang nna.
Yes. So that it starts with self-acceptance, which leads to you having that thick skin from criticism. One can start by affirmation on a daily basis. For example, like I said, coping for understanding that being HIV positive is not a death sentence. Right. Individuals should also educate themselves and those around them. It can be family or friends. This leads to people around you to understand what HIV is all about. That's listening the discrimination. Also, discrimination is usually due to lack of understanding. Have a companion, or there's someone who can support you, because a strong support makes one feel less stigmatized or feel like an outcast, and this should be someone that you trust.
Okay, in terms of eating, in terms of my diet, the
diet, being HIV positive doesn't necessarily mean for your diet to change, but just having a healthy, balanced diet is important for everyone. Good nutrition helps keep the immune system strong and able to fight infections. Right. The right food at a particular time in the day can help the absorption and effectiveness of medication and can help with adherence to the medication. Okay. It can also help to counteract the side effects of some medications, such as and diarrhea. Although most side effects do go away in time. You should be able to get most of your nutrients from a balanced diet. However, many people with HIV, they tend to take a lot of multivitamins and high doses of some minerals, of which you find them at the end of the day, they might become harmful and have side effects, and those things they have to be avoided. Also, some herbal supplements which they tend to take may also interact with the HIV medications, right, and they make them less effective.
So ka go ntse ka tema kana go bo go le Thursday mo tsatsing la gompieno re batla go re go itephare le mmalwanyana. Do I stop drinking alcohol?
There are no significant interactions between alcohol and HIV drugs.
Right.
But however, one may forget to take that treatment when under the influence of alcohol. So it is advisable to reduce your alcohol consumption to a minimum, or preferably stop drinking altogether if already you have a liver disease such as boy hepatitis, because you need to have a healthy liver for your body to get the benefit of the HIV drugs. Also, if your CD4 count is low, because if you are not on medication, heavy drinking could weaken your immune system further. Yes.
All right. So we are young halo hongwe nka se kaka, like if I miss a dose. Ntore ke me di pilisi ka 10 o'clock nya 10 o'clock ba e tahela le khantere 10 o'clock ba kana ke 10 o'clock antla ka 10 o'clock la bo bedi e be le gore ke a go thanya ka 10 o'clock ka muso a ke no tse pedi kana ke no tse taro ka dikire jang.
What you say that missing doses of the HIV medicines it reduces their usefulness and increases the possibility of developing drug resistance, which makes certain HIV drugs lose their effectiveness. But if you realize that you have missed a dose, let's say maybe between 8 to 10 hours later, just go ahead and take the medication as soon as you can. But if it's more than that, just skip the dose, then take the next dose at your scheduled time. Also, if you find yourself missing doses of your medication, talk to your provider about ways to help you remember to take the medications at the same time every day. Then one simple reminder that many people use is to take their HIV medications at the same time as they do another daily task, such as maybe brushing your teeth before bedtime.
Right. And then what are the side effects of taking HIV treatment?
Let me start by highlighting that as of 2018 in Botswana, the main regimen used or prescribed is TLD, which is a combination of three drugs, which are tenofovir, lamivudine, and dolutegravir. So the following side effects. Sorry?
Tenofovir.
All right. Tenofovir, lamivudine, and dolutegravir. That's why TLD. It's a combination of three drugs.
Right.
Tenofovir, lamivudine, and dolutegravir. So the following side effects they're mainly those encountered when we are taking TLD. These side effects are divided into short-term and long-term. The first 2 weeks post-initiation or post-starting your ARVs, one may experience headache, can have diarrhea or abdominal pains, but they tend to ease or stop in no time. However, it doesn't necessarily mean that Mongwe will experience those side effects. Some may experience one or more of those side effects, and some may not, but it doesn't mean the medication is not working. The long-term side effects that we have, or that can be encountered if someone is taking this TLD, it can affect your renal and hepatic function. And mostly you find that those who are affected are the individuals whom, before starting the treatment, they already had underlying conditions which affect the liver and the kidneys. Otherwise, this long-term side effects, they are rare in a healthy individual who is taking TLD. After while still at that, let me highlight that there are also few drug interactions, like we have this antacids. They also interfere with how TLD works. So if you are taking antacids, just give a minimum of 2 hours before in between those drugs. Another thing is that the DTG, the dolutegravir, which is found in TLD, it doubles level of metformin, and when you are claiming claim that more treatment in diabetes, just make sure that you are carefully monitored.
All right. Go bogora gore ya no re tla go bala ha ya ne ra go mo malatsing ya gompieno o sna go dumalana le motho lo mo tirisanong mmogo ya lorato ma morwa mang e bo utlwa go ra re kana mme rala go bona re la ha jana I've got an undetectable viral load a ke motho ile gore ya no wa sia a o nna le ene go re ira jang le ga le ntse se ka ratsana ko nne ke se ke tloa ke go thusile. What is an undetectable viral load?
Okay. An undetectable viral load. So that is when copies of HIV, cannot be detected by the standard viral load test. And in Botswana, we say the viral load is undetectable when there are less than 400 copies. So that being undetectable is good news, because it means that the virus is less able to attack your immune system, which means there will be less damage to your immune system, and this allows people to stay healthier and live longer with an undetectable viral load.
Great. The last question, haretla gore re wele jaanong le lona le ba Tebelopele, when I'm newly diagnosed, le nthusa jang?
The good thing about Tebelopele nowadays is that there are clinicians based in some of our centers. For example, we have wellness clinics in Francistown, Gaborone, and Molekolo.
Right.
So when an individual tests positive, she or he is referred to a clinician to initiate them on the antiretroviral therapy, mostly same day or depending on the clinical stability of the client. And it makes work easier for clients. And also, since this means them starting treatment, they are going to take it for life. Those who cannot make it to the facility, maybe for bleeding or the checkup or logopedic, we tend to follow them at their homes or wherever they are to provide those services. What the basis of the Francis Town Tebelopele ba ka re tshwara mo 241802.
Tuma?
Yes. 241802.
241802. Mema moromang on Health Unpacked mo tsatsi la gompieno ra leboga thata go bona na le rona moduma FM ka kwano o re bolalla gore ha re bua about testing ra bo re bua ka ga eng.
Thank you very much. Maybe in my conclusion, I would like to start by acknowledging the USAID and the PEPFAR, who are the ones who are making it possible for us as Tebelopele under the Tebelopele Mobutuko to provide all these services and assisting our clients. So, yeah, that's it.
Thank you very much, Mama Moroma. Okay, ba e tsho tswa ka go Francis Thano ka ke ntse ke bua le ene le gore ke ena tla ba bua le lona ka maikutlo a lona counseling mamoro mam go tswa ka go Tebelopele ka go jaanong ke le ntsa ka kwa geto ka kwa GC Fairgrounds re dire jalo mo Duma FM ke bidio a mogapi se ro ma ke Duma FM we just rock.
Your health, your wealth. Health Unpacked was brought to you by Tebelopele Wellness Clinics.